All right, everybody, American Storm Chaser here, Terry Tyler, about to give you guys some knowledge. It's storm season, and I want to make sure that you guys are prepared for any type of disaster that's coming in. So what I'm going to do today is I'm going to give you the lowdown on first responder training. Basically, we're going to go from the very start all the way through some of the basic stuff. So right now what I want you to do is grab you a pad and a pen and let's get started. The first thing that we're going to want to do is compile a list of emergency phone numbers. When a tornado strikes a house or a fire happens, the cops, the ambulance people, the first responders, emergency management, they're going to come swarming in the doors, depending on the type of situation. They're going to be looking for people, they're going to be looking for pets, but they're not going to know who's there. Sometimes the houses are empty. And you can help them out by putting a sticker on the door that says, we have 2 pets. A lot of people do that. But what's more common is you have an emergency contact card inside of your wallet. This card is going to have a list of numbers, your next of kin, your doctors, any medicines you may be taking, any allergies you may have. If you happen to be in an automobile accident and you're incapacitated, one of the first things they're going to do is check in your wallet and make sure, they're going to look for that card. Because when they administer first aid drugs, if you're allergic to those drugs, it could kill you. So be sure to have that. Also, they're not going to be able to notify the people that need to be notified, such as your family, your kids, that you've been in an unfortunate situation. So another good tip is to put that information in your safe. If you have a fireproof safe in the house, go ahead and write this information down and stick it in your safe. That way, if your house burns down, it floods, a tornado hits, and God forbid the safe is blown somewhere, they probably won't be able to get in that case. But even if they did crack in, they say, oh man, this is so-and-so safe. So pretty much first step you're going to want to do is get that list of numbers, get that card inside of your wallet, and also you may recommend putting a magnet on your refrigerator. That way people can get in touch with who needs to get in touch with in the event of the disaster. All right, guys, the next step is burns. You don't want to get burned. It's an unpleasant experience, let me tell you. The first step, if you encounter burns, we're going to go over chemical burns first. Dial 911. In the case of a train derailment, a tanker explosion, anything of that nature, call the cops. Do not attempt to rescue the person if the site is hazardous, unless you've been thoroughly trained and have the proper equipment to do so. A lot of times there may be a fire, there may be chemicals there, and it's just going to increase the body count. You don't want to increase the body count. It's not a good idea. Immediately, flush the victim with large amounts of water. If dry lime is the agent, brush it off first, and then flush the victim with water. Remove all clothing and jewelry. Continue flushing the victim for at least 20 minutes. Cover the victim with a clean sheet. Continue flushing the victim until they complain of irritation. Monitor the victim's breathing and pulse. You want to make sure that the person is stable and not getting to the point of where they may go into cardiac arrest. Treat the victim for shock. We went over shock in the earlier lectures, so if you don't know what to do about shock, go back and take a look. For chemical burns to the eyes, flush the eyes with water until professional help arrives. But here's the thing. Do not use anything but water. All right, the next type of burns we're going to talk about are heat burns. Heat burns can come from stoves, fires, maybe electromagnetic radiation. Just heat that burns the skin. In the case of somebody on fire, the first thing that you want to do is put that person out by either dousing them with water or rolling them on the ground. Stop, drop, and roll. Remember that. Now, you may want to avoid spraying them with a fire extinguisher. I know that may seem intuitive, but a lot of times fire extinguishers work by sucking the oxygen out. If you spray somebody really badly with a fire extinguisher, depending on the severity of the fire, particularly in the face area, you may do more harm than good. The next thing you're going to do is call for help. Dial 911, get the firemen, get the paramedics on the scene. And the next step, of course, is going to be check the breathing and the pulse. Give CPR if needed. It may be difficult to check the pulse depending on the severity. The skin may be charred or mangled, but make sure that you can do that. Keep the victim warm. I know that may seem counterintuitive given they just got out of a fire, but you want to make sure that victim is warm because they may be going through shock. So follow the shock treatments. Typically when a person goes into shock, their ability to maintain homeostasis is affected. Now, this is talking about major burns, fires on somebody. We're going to talk about minor burns instead, like you may get on your toaster or your stove. For minor burns, if the skin is not broken, immerse or soak the affected part in cold water. Wrap the affected part with a clean, lint-free dressing, and if the skin is not broken, moisten the dressing to help relieve the pain. Now, back to the major burns. You're going to want to wrap that major burn in a dry, clean, lint-free sheet. Place the dressing between the fingers so they won't stick together. Cover the burned eyes with sterile, moist pads. Pro tip: do not apply ointments to the burned area. You don't want to use alcohol or iodine or hydrogen peroxide. Those type things are not just going to cause severe pain, they could wreck the skin. So don't use that. Another tip is don't break open any blisters. A good rule of thumb is to, keep your hands off of them and let the professionals handle it. Try to get the fire out. Do what you can. In the case of, say, a factory fire, hotel fire, there may be lots of people burned. So you'll want to treat as many as you can and get that stuff done. Talk about is bleeding. I know you guys love blood and guts, so let's get right to it. There's a number of arteries that may be impacted, with a cutting motion of things blown around in a tornado. The most common artery is the carotid artery. The carotid artery is located right here. You've got your femoral arteries, which are located right here. You've got your brachial arteries that run right down here, and your radial arteries that do this. You've got your popliteal arteries. They come down here, and your dorsolaris pedis artery and posteriotrial artery, also known as the Achilles tendon. If you get hit in any of those arteries, you're going to start to bleed out pretty damn fast. So what you're going to want to do is, first things first, call for help. If you happen to have a phone, dial 911. And also, don't forget to take those universal precautions we talked about before, having that card in your hand. Apply direct pressure to the wound. You want to apply the pressure firmly to the wound and dress that wound if possible. If the bleeding does not stop, hold the arm or leg above the level of the heart. See, the heart's going to be pumping. You're going to want to lay down and stick that leg up. That way it kind of keeps the stuff going down. Apply fingertip pressure to the artery above the bleeding site at a pressure point. Do not remove the original bandage. If you do, it could cause more blood to come out, and the more blood comes out, the closer you are to dying. So if your dressing becomes soaked, place another dressing on the wound on top of the original dressing and apply the pressage again. Now, a lot of people may be saying, hey, what about a tourniquet? The tourniquet is to be used in only a last resort because it can jam up the arteries and it can cause more trouble than it's worth. Now, all of these tips that I discussed are, basically layman's terms for external bleeding. External bleeding is bleeding of blood coming outside of your body. Now, internal bleeding is another story. With internal bleeding, you may not be able to see hemorrhaging, organs that may have ruptured, things that may have happened, such as like from a fall or blunt force trauma. What you're going to want to do is keep calm. If you come upon somebody in a wreck or an unfortunate situation, you want to go ahead and make sure that the victim remains calm. Monitor the breathing. Monitor the pulse. If needed, start CPR and treat the victim for shock. We're going to go into shock later, but I want you to do is take a look at some of these graphics. These graphics will help guide you through the procedure. Now, as we discussed before, shock is a condition in which a person is overloaded completely by the trauma of the disaster. Some people are unable to move, they freak out. Some people are just kind of out of it, But the key is, if you see somebody in shock, don't move them, because spinal injury could be suspected. If they are moving around, you want to make sure to have them lie down and stay calm. Monitor the breathing, monitor the pulse, and if needed, start CPR. If they happen to be bleeding externally, attempt to control the bleeding. You may want to use latex gloves. If it's that bad of a situation and you want to be a hero, do what you can to control that bleeding using some of the techniques we discussed earlier. You may need to use some splint fractures. If there's some compound fractures or the legs are busted up, arms are busted up, put a splint on it. Place one blanket under and one blanket over the victim to maintain body heat. Some people begin to lose their body temperature. The core temperature goes out of whack when they're in shock. You want to make sure that they keep a level temperature. Elevate the legs. The legs need to be about 12 inches up unless they are fractured. Elevate the legs again, and if the victim vomits, log rolling, like you're just rolling a log to the side to protect his airways. A lot of times people vomit and they suffocate on their own vomit. It's a common way that people die. Don't give them anything to eat or drink, because as we just said, they could vomit and they'll suffocate on their own vomit. Now, the final step is monitor the breathing, keep in contact with the victim until professional help arrives. I understand that I'm talking to you guys from layman's terms. This is designed to be a layman's course. I don't expect anybody to get out there and save the world, but I do expect you guys to be aware of what could happen in the event of a disaster. Is you or someone you know experiencing chest pains? That could be a sign of a heart attack. We're going to go over what to do if you're experiencing chest pains. The first thing you want to do is assume that the victim is having a heart attack. If the victim is not breathing, perform CPR. Call for help. Dial 911 or call someone who's a trained professional. Stay with the victim. Keep the victim calm and at rest. You're going to want to reassure the victim. Keep the victim calm and in a leisurely position. This can be laying down or propped up. Propped up is the best way to go. Make it easy for the victim to breathe. In a semi-sitting position may help the individual to breathe. Loosen tight clothing, neckties, belts, bras, etc. Any restrictive clothing you're going to want to go ahead and remove. Keep the victim warm, but don't overheat. Ask the victim what medications he or she may be taking. Give this information to the medical team when they arrive. It helps to go back to the first section and compile that list of information. You're going to want to have that card ready as the victim that you could give to the person that's administering the treatment. Monitor the victim's breathing and pulse. If the victim vomits, turn the head to the side to protect the airway. Continue to reassure the victim until professional help arrives. The next section we're going to go over is CPR. Now, a bit of a disclaimer, crew. This is not a formal CPR training. You're going to want to go to an organization like the American Red Cross or your local fire department and see if they offer formal CPR training. It could be dangerous to attempt CPR on a person if you do not know the proper way to perform the procedure. With that said, let's go over some basic things about CPR. There are two basic components to CPR. The first is mouth to mouth. The second are chest compressions. For an adult, you're going to want to shake the victim and ask them if they are okay. Yell for help. Try to get someone else there to help the victim. Open the airway. Thrust the jaw forward without moving your head or neck for suspected spinal injury to the victim. Sometimes the individual may be hurt. Jostling the neck may break the neck. We do not want to do that. Look for chest movement. Listen and feel with your ear over the victim's mouth and nose for breathing. If the victim is not breathing, blow into the victim's mouth 2 times by placing your mouth over the victim's mouth while pinching his nostrils together. Observe the chest rise and allow the victim to exhale between your breaths. Feel the carotid artery and check for a pulse. If adequate, continue rescue breathing once every 5 seconds. If there is no pulse, start chest compressions. Find and maintain proper hand placement between the ribs here. You want to place one hand on top of the other, 2 inches above the bottom of the breastbone, and compress the adult chest 1.5 to 2 inches 15 times. You're going to want to do 15 compressions in 10 to 12 second intervals to try to get them moving. Give 2 breaths and repeat the cycle of 15 compressions and 2 breaths until help arrives and takes over. Now, CPR is a little bit different for a fully grown adult than it is for children or infants. We're going to go over some of those techniques now. For a child, use the same techniques as above, except use care not to over-breathe into the smaller lungs, and only compress the chest 1 to 1.5 inches at a ratio of 5 chest compressions to 1 breath. 1 and 2 and 3 and 4 and 5 and breathe. Repeat. 1 and 2 and 3 and 4 and 5 and breathe. For an infant, you want to use the same technique as well, but only use puffs from your cheek and only compress the chest 1/2 inch to 1 inch at the breastbone using 2 fingers located 1 inch below the nipple line. 1 and 2 and 3 and 4 and 5. Breathe. Let's do it again. 1 and 2 and 3 and 4 and 5. Breathe. All right, guys, if you're choking, you're going to want to follow some of these procedures. We're going to go over 2 different scenarios. The first scenario is for the conscious victim. The second scenario is for the unconscious victim. Now, for the conscious victim, you're going to want to go ahead and ask them if they can speak, if they can cough. If so, don't interfere. Encourage the victim to cough up the object on their own. Now, if the victim is unable to speak or cough, stand behind the victim and wrap your arms around the victim's waist. See the document pictured here. Place the thumbs of your hand just above the victim's navel and below the rib cage. Grab your fist with the other hand and press onto the victim's abdomen with a quick upward thrust until the object is expelled or the victim becomes unconscious. Pro tip: you may want to research what's called the Heimlich maneuver. It's a good maneuver to use if you or someone you care about is able to get choked. Now, the next step we're going to research is the unconscious victim. If the victim's unconscious, you're going to want to place the victim on the back. Have someone call for help. Dial 911, get the paramedics on scene. Attempt mouth-to-mouth resuscitation. If it's unsuccessful, straddle the victim and place the heel of one hand slightly above the navel and below the rib cage. Place the second hand on top of the first hand. Press it to the abdomen with a quick upward thrust. Repeat this procedure 6 to 10 times. Check the airway for the object, and if you see it, get it out of there. Repeat steps 3 to 4, the thrusting, the lifting, all that stuff, until the help arrives or the airway is clear and the victim is moving again. Go over convulsions. Convulsions are also colloquially known as seizures. When you see somebody doing the floppy chicken, you'd better call for help. That's the first step. Second step is going to be have the victim lie down. Get them down on the ground because there's fall risk if you're standing up. Loosen all the tight clothing, belts, neckties, bras, etc. Do not restrain the victim. You want to protect that victim from the injury of self and others. After the convulsion, keep the victim at rest and positioned on the side with the head down in case of vomiting. After convulsions, victims usually have a period of unconsciousness where they're not able to be reached. If this occurs, you're going to want to check the victim and start CPR. Protect the victim from embarrassment due to loss of bladder and bowel control. Sometimes people will shit or piss themselves, and it can be a humiliating experience. A lot of times there's been guys that overdose on drugs, and they laugh at them, but for the victim, it's a tremendous suffering and possibly death. So you want to try to protect that if you can. Do not place any object in the victim's mouth unless trained to do so. In some cases, during a seizure or convulsion, the victim will bite, and they will bite hard. If you put something in there, they can shatter their teeth. If you put your hand in there, they can bite your fingers off. Sometimes a victim, it's commonplace, they will bite their tongue. Sometimes they bite their tongues off. Sometimes they swallow their tongues. So when you're dealing with somebody who's having a seizure, it's best to get help quickly. Now we're going to talk about diabetics. What do you do with them? Well, if they're conscious, the first thing you're going to want to do is call 911 if they are having trouble. The diabetic may seem intoxicated due to an imbalance of the blood sugar. You have to make sure that the victim is alert enough to eat or drink before you attempt to render sugar. Now, what you want to give them is sugar, candies, colas, soft drinks, anything with that sugar in it, refined sugar. But the thing you're going to want to avoid is diet colas, things with artificial sweeteners, things that don't have that sugar in there that the diabetic needs in order to come back to reality. Assist the victim with eating or drinking. If available, place the sugar under the tongue for quick results. Stay with the victim until the professional help arrives. Now, if the victim is unconscious, call 911 immediately. Check for breathing. If the victim is not breathing, initiate CPR. Check the victim for the medical alert necklace or bracelet or the card that may be inside of the wallet. This can confirm that the individual is a diabetic. Do not put any sugar, candy, or liquids into an unconscious victim's mouth. That's a super no-no. Be alert for convulsions. If the victim begins convulsing, he may be or she may be a danger to you or others. If the victim vomits, turn the head to the side to prevent airway blockage. Stay with the victim until help arrives. Okay guys, the next thing we're going to talk about is drowning. Now, typically there are two types of drowning accidents you may encounter. The first one is a diving accident. The second one is a drowning accident. Now, a diving accident is going to be a little bit different because the victim may have hit contact with the bottom, broken neck, broken bones, broken back. If they went down feet first, broken legs, ruptured spleen. There's a plethora of problems that could affect an individual from a diving accident. Of course, you're going to want to dial 911. Get on the horn with the fire department or the paramedics and let them know you've got an emergency situation. Automatically assume that the victim has a spinal injury. Do not move the head, neck, or back out of a normal, straightforward position, unless you have no other choice but to drag the person out of the water if drowning is imminent. If needed, provide CPR without tilting the head. Use the jaw thrust maneuver as discussed in CPR earlier in this lecture. Drowning. If the victim is not breathing, start CPR. Call for help. If the victim is breathing and has a pulse, check for other injuries. Keep the victim warm and treat for shock. A lot of times people may freak out during an incident like this, and you want to make sure that they don't get too far gone because it could cause other problems. In the case of electric shock, you're going to want to avoid touching the victim if they're in contact with the wires. If you do, you may shock yourself. Call for help. Dial 911. If possible, shut off or disconnect the electricity at its source. Do not risk your life by attempting to move the victim. After the electrical source has been removed, if the victim is not breathing, perform CPR. You will want to treat electrical burns like major heat burns, dressing, wrapping, etc. If you're confused what to do with these type of burns, scroll back through the playhead and go over the burn section. The next thing you're going to want to do is treat for shock. Now, not this type of shock, but the regular shock. Again, if you're unfamiliar with what to do, go back, scroll back in the playhead. Step we're going to talk about is fractures and sprains. If you encounter someone with a fracture or sprain, call 911. Don't move the victim unless a life-threatening condition exists. You may further compound the problem. Before splinting, treat the bleeding. If you're unfamiliar with how to treat bleeding, go back to our previous section on bleeding. Do not push the bones back in to the wounds. That could cause major damage. If you're unsure if a bone is fractured, splint it anyway. To use a splint, use any rigid objects, a board, a rolled newspaper, a stick that's very strong, and brace the joint above and below the fractured site. If available, apply an ice pack directly over the fracture site. This will keep the pressure down and inflammation and can ease pain in some victims. Treat for shock. Again, you're going to want to use the steps outlined for shock that we discussed earlier in this presentation. You're going to want to go ahead and treat sprains like fractures. Splint them too. A sprain is a less severe form of a fracture, but it is indelibly painful. Now, for a sprained ankle, you're going to want to use a splint made out of a pillow. It can be difficult for the victim to walk. So you're going to want to go ahead and assist them moving wherever they need to go. What I speak about is cold exposure, hypothermia, and frostbite. Call for help. Now, you may be in a remote area and you may not be able to call for help. So what you're going to want to do is remove the victim from the cold if you can. Get into a log cabin or inside of a vehicle. If needed, start CPR. Gently remove all wet clothing and place warm blankets on the victim. If the victim is conscious, give warm fluids to drink, hot cocoa, coffee, etc. Cover the frostbitten part with a warm body part, i.e., put them in the armpits, in the groin. Do not rub or massage the frostbitten limb. Do not use heaters or fires to rewarm the frostbitten areas. Do not apply ointments or chemicals to the affected areas. And don't handle the victim roughly. If medical help is not available, rewarm the affected part in a large container of water with a constant temperature of 100 to 105 degrees. Cover with dry sheets. You're also going to want to go ahead and follow the shock procedures that we've gone over, because typically victims that are suffering hypothermia and frostbite are probably suffering from shock as well. In heat stroke, with heat exhaustion, the skin is going to be wet. With heat stroke, the skin is going to be dry. Now, with heat exhaustion, you're going to want to move the victim to a cool environment and remove the outer clothing. Call for help. Dial 911. Treat for shock if the victim is in shock. Sponge the victim with cool water. Fan the victim, but avoid chilling. Do not give the victim anything to drink. For heat stroke, the skin is going to be dry. You're going to want to move the victim to a cool environment and remove all clothing. Call 911 and get paramedics on the scene. You're going to want to move very quickly because this case, the body is overheating. Put cold ice packs under the armpits, the groin area, and over the head. Each side of the neck, place ice packs. Put ice packs on the chest area and on the inside of both ankles. Be prepared for convulsions. If convulsions occur, follow the procedures outlined earlier in the video. If needed, you're going to want to go ahead and start CPR. The next thing we're going to talk about, people, is poisoning and drug overdoses. Call for help. Dial 911. If the victim is not breathing, start CPR. Do not induce vomiting or give anything until you contact the Poison Control Center. Give them the name of the poison or drug, if known, and how much the victim has taken. Follow the Poison Control Center's instructions. Snake bites and insect stings. To identify a poisonous sting, take a look at the following chart. Pit vipers are poisonous, but you can't rely on identifying them by their triangular head. They feature an elliptical pupil, a pit, and a nostril. Rattlesnakes, cottonmouths, and copperheads have the pupils elliptical and a sensory pit present between the nostril and the eye. Most scales on the underside of tail-like single belly scales are not divided. Again, do not rely on the triangular head. The non-poisonous snake, except for the coral snake, features a round pupil and a nostril. It does not have the pit. The coral snake, however, has red and yellow rings that touch. Every other red and yellow ring, similar non-poisonous species, have red and black rings or blotches touching every other ring black. The good rule of thumb is red and black, friend of Jack. Red and yellow, kill a fellow. Now, when we're dealing with the snake bite, the good rule of thumb is to keep the victim calm. And if you're bitten yourself, keep calm. Don't move around because it's going to elevate your heart rate and keep the poison circulating through the veins. Call 911 immediately. Get the paramedics on scene. If possible, identify the snake, but do not risk getting bitten. Remove all rings, bracelets, etc. Tie a snug band above and below the bite. You're going to want to clean the wound with soap and water and splint the affected area. Treat for shock if the victim is in shock and start CPR if needed. As soon as you're able to, take the victim to a medical facility immediately. Now with insect stings, you're going to want to go ahead and try to remove the stinger by scraping. Don't pull out or squeeze. If possible, try to place an ice pack over the sting or bitten area. Identify the insect, but don't get hurt. Be alert for allergic reactions. Some people have allergic reactions which may result in difficulty in breathing, wheezing, sneezing, coughing, facial swelling, hives, itching, nausea, vomiting, and/or abdominal cramps. If the situation is bad enough, don't hesitate to call 911. Now, what do you do if you're in a car accident or you come upon a car accident? The first thing you're going to want to do is call for help. Dial 911. You're not going to want to move an accident victim unless it's necessary to protect the life of the individual. Assume that all accident victims have spinal injuries. This may seem a bit callous or rude, but the last thing you want to do is try to help someone and get sued. Follow the alphabet. A, B, C, D. Airway. Make sure the victim has an open airway. B, breathing. Make sure the victim is breathing. C, circulation. Control bleeding. D, disability. Splint all fractures. In any accident scenario, you're going to want to use common sense. If there's vehicles in the roadway and it looks like another accident may occur, get away from the trajectory of a potential accident. And if possible, initiate road flares or set up a warning to prevent other motorists from causing a pileup. Stay calm. When the shit hits the fan, you may freak out. So just take deep breaths, stay calm in the situation, and get help quickly. Summon your local fire department, call the cops, anybody you can get on scene. Stay with the victim or victims until the help arrives, and continue to follow the steps listed in this video. So now we're going to talk about tips for prevention of getting exposed to infectious diseases. You're going to want to use the universal blood and bodily fluid precautions in the care of all patients. Use appropriate barrier precautions in order to prevent skin and mucous membranes exposure. Protective gloves should be put on before contact with blood and body fluids and changed after contact with each patient. Mask and protective eyewear or face shields should be worn to prevent exposure of mucous membranes of the mouth, nose, and eyes during situations that are likely to generate droplets of blood or other body fluids. Hands or other skin surfaces should be washed immediately and thoroughly if contaminated with blood or other bodily fluids. This should be done immediately after gloves and other protective shields are removed and properly disposed of. Use soap that kills staph, strep, fungus, and viruses if possible. Work up a lather using friction for at least 15 seconds. Rinse your hands well and dry them off with a paper towel. Use the paper towel to turn off the faucet. You'll want to avoid cross-contamination. To minimize the risk involved with an emergency mouth-to-mouth resuscitation, ventilation devices such as a resuscitation mouthpiece, bags, and other devices should be available in areas where the need is predictable. For example, first aid kits. Well, guys, I hope you enjoyed this presentation. This isn't designed to give you a basic understanding of what you could and should do in a variety of situations you may encounter out there. Always remember to put safety first. If it's dangerous, just don't do it. Be there for your fellows. Be there for your brothers and your sisters and your country. Do not fail them. Follow the precautions in the video. If you have any suggestions for future videos, click in the comments below. And don't forget to subscribe. Take it easy, y'all.